Chinese province of Hubei has already eased its lockdown and is allowing most residents to move freely. Wuhan, the epicenter of the coronavirus outbreak, will lift its lockdown on April the 8th, marking a significant milestone in the fight against the deadly outbreak. So what are the conditions allowing an ease of the lockdown? Should we be worried about the risks of a second wave of infections? And what lessons can be shared with the U.S. and European countries? To talk about these issues and more, I'm pleased to be joined by Professor Chen Hong from East China Normal University, Zhou Ning, medical doctor from cardiology section of Chongji Hospital, and Dr. Margaret Harris, WHO spokesperson on COVID-19, and Dr. Eric Rubin, editor-in-chief of the New England Journal of Medicine. That is our topic. This is Dialogue. I'm Zhou Yue. So let me start with you, Dr. Zhou. Starting Wednesday, actually March the 25th, the people in Hubei, except for Wuhan, the capital of the province, were allowed to leave if they have a green QR code on their phones saying that they are healthy. First of all, what do you think of the ease of restrictions of movement, and why was Wuhan not part of this?
Yeah, so that's a good news that the cities apart from the Wuhan was allowed to leave the province if they have a green health QR code. But Wuhan was excluded because, you know, in the beginning of the outbreak of the COVID-19 epidemic, most of the cases was confirmed in Wuhan city, and so far 95% of the cases were still in Wuhan. Although we don't have new cases confirmed in the past days, but that's not enough. You know, at least we have no more new cases confirmed, which continued for 2 weeks after the zero increased cases was confirmed. So we need another 2 weeks. That means our city is safe. And at that time, I think that is April 8th. At that time, Wuhan will be included in these cities of Hubei Province.
How should we understand the exact date for the lifting of restrictions? March the 25th for Hubei Province and April the 8th for Wuhan. Why were these dates were chosen?
I think that's the date was chosen because it is after 2 weeks, at least 2 weeks after the zero increase of the new confirmed cases from that date, and another 2 weeks. That date is April 8th, I think.
And Professor Chen, of course, that means a lot of people that's stranded in Wuhan and Hubei will very soon be moving to other parts of the country. What do you think that will mean for this country in terms of the possibility of more infections, if that should be the case?
Well, I think actually transmission of the pathogen largely depends on movement, mobility of the population. That is obviously the prime cause. So actually, the initial measures to limit, restrictive measures, you know, to limit the movement of the people is actually taking effect. But now that actually there is now a significant plunge of the numbers, so that indicates that actually the general situation is not only in control, but actually the whole province now the condition is quite safe. So that means that actually there's a turning point. I think this is a very important decision actually to partially lift the travel bans for the province of Wuhan, apart from the province of Hubei, apart from Wuhan. You know, all the travel restrictions have been lifted, but for Wuhan, you know, another 14 days. That is actually also an indication of prudence in making decisions.
And by then, can we claim that we have already beaten coronavirus, at least within China?
Well, I think it is actually definitely too early to claim victory at this stage, because this is by no means mission accomplished. We can allow no, you know, drop of guard. We shouldn't be, you know, breeding a sense of complacency at this stage. But on the other hand, of course, this significant steps have been, moving towards victory. So actually, on one hand, of course, we need to every kind of prudence and caution. On the other hand, of course, we need to have the confidence, because as we know that actually trains, high-speed trains are traveling into Wuhan. And also, on the other hand, of course, even within Wuhan, the metro system, the underground is operating, and everything actually is resuming its normalcy. So I think actually, on one hand, prudence. On the other hand, we need to have confidence.
Prudence and confidence. And Dr. Zhou, of course, the Wuhan people have a lot of that. And it's the provincial capital. It has been hard hit by the virus. You've been treating some patients there. How do you feel the people living in Wuhan are feeling right now? Are they in a rush to come back to normal?
Not really, not all normal. Actually, we suffered a lot from the epidemic of this COVID-19 in the past months, but now it's getting better and better. We have we can take the metro and we can take the bus and very freely if you have a healthy green healthy QR code. And but there's still around 2,000 COVID-19 patients in Wuhan city. They are in the hospital to get treatment. But so far, it's getting better and better, I think.
And after Wuhan lifts its restrictions and Hubei allowed people to go around the country, should we be worried about the second wave of infections, Dr. Zhou?
Yeah, that's a problem. That's a matter of concern. After the restriction was removed from the Hubei Province and the other provinces in China, so people will go around all of this country. So that's that's kind of the threaten to get a second wave of the outbreak of COVID-19. But I think we can control this very well, because everyone will go out of this province. They need to be confirmed that the virus test is negative. That means they have no infections. And until they after get the green health card, that means the negative test of the virus. That means they are safe. They can go anywhere because they are safe. They're healthy. So we need to pay attention to the outbreak of the second waves, but we don't need to worry too much about that.
Well, you said that those who got infected, when they recover, they are safe. But actually, a lot of people worry about their conditions. There are probably 70,000 of them in Wuhan. They've recovered, but are they in a good shape to get back to their normal life? And people probably turn away them because of fears.
Actually, we noticed this phenomenon that some cases who was cured up in the hospital and then discharged, when they return to their home, they get a second time of the repeated virus test and find their virus test is positive again. That's not very rare, but I think there's many reasons responsible for that. Firstly, when it was discharged, we actually did the virus test for them. But some of the test was not so accurate, and it depends on the efficiency of the kit, the test kit. Some patient who is actually still positive, but the result of the testing is showed as a negative. That's reasonable, because any kind of the method is not 100% correct, right?
So if the test is not 100% correct, and they still can carry the virus and infect others, how can we be sure that they should be join normal life as everybody else? So apart from the virus test kit, we have another kind of method, that is the antibody test by blood samples. We draw the blood from the patient. And another way is repeat the virus test. At least we did twice, and in some hospital we did 3 times for the virus test before they were discharged. So let's make sure that their virus is actually negative before they went back home. All right. Thank you very much, Dr. Zhou, and thank you for your hard work in Wuhan. And Professor Chen, of course, China is coming back to normal, although slowly and with caution, but still there are a lot of people worry about the threat of inbound traffic from elsewhere, and also those who have not tested positive,
Yes.
but probably they carry the virus, as Dr. Zhou said. So socially, what should be the public policy be in terms of another round
Yes.
of breakout?
Yes, I think actually at this moment, as I said, that's actually first, obviously, we need to boost up our confidence in the efficacy of the measures. On the other hand, we need to be very prudent because actually the threat is still there. Until actually, we have developed the effective vaccine and also the effective cure of the disease, we cannot be 100% be resting assured that actually we are actually winning this victory. So on one hand, of course, definitely within the country, domestically, we need to be constantly vigilant of any potential possibility of resurgence of the infection, any possible likelihood of the rise, another rise of the curve. On the other hand, of course, we need to adopt and resume and continue maintain all the personal hygiene, social distancing, try as much as possible to stay away from crowds, and also wash hands and mask wearing, all those kind of protocols that we have been observing. These are very important because at this moment, actually, any time people might drop their guard, and sometimes things might definitely develop towards some kind of unpredictable.
But Professor Chen, that's going to be
largely this virus
very expensive
a lot of
and
about features, qualities.
If people still have to practice social distancing and avoiding crowds, that is not going back to normal. That is still very abnormal.
I think for the periods, people need to be exercising self-restraint because everything is about the preservation of human life. This is not about comfortability, about a kind of a temporary relaxation of the spirit, but this is all about the preservation of individual life, and as well as even about the human race. So from that regard, we definitely need to be quite alert and vigilant. That is very important because, as I just said, largely the quality, there's a lot of obscure quality of this virus. We don't know much about this novel coronavirus. So scientists and medical workers they're working hard to find out more about the virus.
Yes, exactly. We have still a lot of things to learn about this virus. About the knowledge of the virus, let's talk to Eric Rubin, Editor-in-Chief of the New England Journal of Medicine. So Eric, we have seen more than nearly 140,000 infections and 2,500 deaths in America. A lot of people are asking, Americans saw what happened in Wuhan, in China, and in Italy. Why didn't America try to bring that infection number down in the first place?
I think that's a great question. I'm not sure now is a time to be answering it, though. Right now, we have what we have. We've got the resources that we have. There clearly were mistakes made, and we were not adequately prepared for this. And I don't want to downplay it. Those mistakes are going to cost tens of thousands of lives, and someone should pay the price for that. But right now is not probably the time to figure out what went wrong.
But the WHO has mentioned the most important thing is testing, social distancing, that means quarantine, and also source tracing. What hasn't been done enough in those three aspects in America?
I think that in particular, testing has been very problematic. It is improving, but still not nearly where it should be, although markedly improved from where it was a while ago. And social distancing has been instituted in many places, in the hardest hit places. It may have taken a little too long for it to happen, but it really has taken hold in most of the hard hit areas. Of course, it's a big country like China, and the amount of social distancing you need in different places is going to vary.
And in China here, people worry about, although we have seen the infection cases going down, but still people are carrying those viruses but do not show symptoms, and they can transmit the disease. Is this also the major worry in the United States, and those people who are still carrying the virus but they don't get sick?
I think there are two concerns. Right now, we're most concerned about the very large number of people who are sick and those who are very ill, and the first priority is to take care of them. But there's the longer-term issue, which you're also facing in China. As you loosen social restrictions, and as there are people carrying virus, particularly, as you say, the asymptomatic people, that could result in another big burst of infection.
And Dr. Anthony Fauci, the top infectious disease expert in your country, said it could be 100,000 or 200,000 deaths in America. I don't know what kind of modeling he relies on, but do you think this kind of estimate is reasonable, or could it be even worse, or not that bad?
I think that Dr. Fauci's estimates fall right about in the middle of where the modelers are saying right now. So I think it's a very reasonable estimate. It's reasonable in that it might occur. It's disastrous, though. I don't mean to play it down. It's terrible.
And also the effects of lockdowns, because here in China, lockdowns obviously worked, at least in Wuhan and Hubei. And people stay at home and keep a distance, and that reduces the rate of transmission. But do you think lockdowns in major hotspot places like in New York and Washington and California are working as they're designed to be working?
They will work. There are different degrees of lockdown occurring in different places, but they will have an effect. It's just that that effect is delayed, so it's a little bit difficult to see. There is evidence that in Seattle, which was the first place where a big outbreak occurred, and also the first place to lock down, that there has been an effect, and that effect should become more apparent over time, just like it did in Hubei.
And also the behavior of the virus itself, do you think it has mutated in any way? Its infection has changed any bit differently from other parts of the world?
I would say that thus far there's no evidence of that. Certainly the virus mutates, but we don't have evidence that those mutations have any real consequences right now.
And also the weather issue. Do you think that the summer warmer weather will keep it down like any other coronaviruses, that it will peter out because of the warmer temperatures, and that will let the thing go away?
That would be great. I will point out that there is an outbreak in Australia right now in the other hemisphere, and some of the related coronaviruses occurred in warm areas, particularly the MERS coronavirus in the Arabian Peninsula. So there's no guarantee, but one can hope.
And what is your explanation of the mortality rate in America, at least for now, because it's roughly 1.5%. That is much lower than Italy and Spain, but it's still quite extraordinary.
It is awful. Now, remember that a lot of that is a consequence of limited testing. Only the sickest people are being tested, and they're the most likely to die. We really haven't had any surveillance of people who are asymptomatic, and we're doing very little testing of the more mildly symptomatic people. So I suspect that that number will come down as testing is widened, but it does emphasize that even in a country like the U.S., just like in China, where there are good medical services, this is a deadly disease.
And what is your estimate when the United States infection will peak?
Well, I'm not going to put any bets on the table, I think.
Is it a matter of weeks or months?
It's a matter of months, probably, if I were to guess. I'd come back to the idea, though, that when social distancing is loosened up, we run the risk, as China will, of there being another outbreak. So it's difficult to know when to do it and how much loosening there should be.
Wow, that is a dilemma for the decision makers in America. Thank you very much, Eric. Let's turn to Professor Chen in Shanghai. According to a very famous Dr. Zhang Wenhong, he is the leader of the Shanghai team in coping with COVID-19 response. He said it is likely that the coronavirus pandemic will reach its peak in October, and then it will rise to another one after that, that is this autumn. First of all, what do you think that means for the people here who are still busy coping with the aftermath? And if that's the case, how should the government respond?
Well, I think firstly, I appreciate Dr. Zhang Wenhong's cautiousness, because he has been really developing an overall, overview of the situation and also in-depth, insights into the situation. So I think actually his estimates of the situation is quite dependable. And because actually, as we have been discussing, there are still a lot of features that are unknown to us, and also about the mutation of the virus. So it is very likely that actually there might be a resurgence sometime later in the year. So, and also, according to some other, features of some other viruses, there are still a lot of things that are not known. It is a very, new virus, mind you, that actually it's very unlike the, for example, like SARS virus. SARS virus can be, latent and, simply latent there for, quite a period of time. Early stages in the incubation period, SARS virus does not, simply infect. But for this virus, COVID-19, it is infectious from the very beginning and throughout the period of the infection. So it can actually have some kind of a very deadly, effect. And on the other hand, of course, as we have been discussing, there are some asymptomatic, patients who exhibit no traces of symptoms, but on the other hand, they can be roaming around freely in the crowds in the city, so they can be passing on the pathogens to other people, and that can be also quite difficult to handle, to detect, and also to prevent. So yes, I do believe that actually we need to listen to wise voices such as Dr. Zhang Wenhong's.
But that means everybody should keep their guard on, and socially that is significant, because from the people to the institutions and government, they cannot plan everything important because there are a lot of uncertainties ahead.
Yes, yes. Uncertainty, I think, is actually one of the features we can characterize this virus. But obviously, of course, the whole country will resuming economic activities in a very, prudent way, stage by stage, and I think this is very, very good. So we cannot actually, allow any kind of like over-optimistic, sentiments among the public and even among the decision makers. On the other hand, of course, we need to, to look at the situation case by case and try to control the situation, keep the situation in hand.
Yeah, indeed, and the government should really take it seriously. And now we have Margaret from the WHO,
yes.
and she is replying our questions. He's the WHO spokesperson, Margaret Harris. So Margaret, across Europe and the United States, many countries are now repeating what China has been through. New cases of coronavirus continue to surge, medical supply depletion, and hospitals overwhelmed. What lessons have been learned and what have not?
Good afternoon. Well, I think the very important lessons that have been learned are the crucial things you need to do to stop transmission, which is to find every case, to really test everybody and find everybody that's been exposed to those people and ensure that they can be quarantined, to really keep people who are potentially infectious away from other people. There's been a lot of focus on lockdown, but what we really saw that was done very effectively in Wuhan was monitoring all the people who could potentially have been exposed.
But the problem is there are shortages of testing kits
transmission.
and capabilities in many countries.
That is a problem, so therefore you have to think about how can you identify everybody potentially who could be infected. And you also have to scale up. You have to find every way you can to scale up your testing, your testing kits.
And another thing is that quarantine worked in Wuhan because when people stay in quarantine, we will find those who might suspected of the infection and go to a triage system, and we will find those patients. But why lockdown, it seems, is not working so well in other parts of the world?
So lockdown is like a much more blunt instrument. Quarantine is you quarantine people that you know have been in contact with somebody who's infectious. So that's why we keep saying find everybody who is actually currently infectious and find everybody around them who has been exposed to them, because that's how you're going to shut down the transmission. Lockdown works as a general thing for a short while, certainly, but it's only one possible strategy. The main strategy must be finding every case, detecting everybody who's possibly exposed, and ensuring that you can treat the people who get very sick.
And we have seen infections in almost 200 countries and regions around the world. And the WHO, as a world public health organization, what is your priority?
Our priority is assisting absolutely every country to stop transmission. We have seen that in Wuhan that's been possible, in China that's been possible, we've seen in Korea that's been possible. We've also seen other parts of Asia where they managed to slow down their outbreak, like Singapore, like Taiwan, like Hong Kong. So it is not inevitable that you have a massive outbreak. There are many things that can be done, and our job is to help every community to achieve that.
And a lot of countries are struggling with the decisions, saving lives and saving livelihoods, keeping people at home, but also keeping them sane and healthy. What is your advice to those people who are facing the choices like that?
Our advice certainly is exactly what you say. Stay sane and healthy. So how do you do that? Think about taking exercise. We say make sure you get 30 minutes of exercise one way or another. If you're stuck inside the house, use a dance video, do an online exercise class. Make sure you get that 30 minutes because you'll feel so much better. If you're working from home, as most of us are now, get up every hour. Don't just sit in front of your laptop all the time. Stay in contact with the people you love, and including your workmates, because that's often people's social network. But stay in touch with the people you love, and think about the vulnerable in your community, the people that may be a little lonelier. Find ways to get in contact with them, find ways to help them out. Essentially, this is something we can all get through if we stay together. So we have to stay apart in order to stay together.
Yeah. Although we stay apart, but we still stay together. Thank you very much, Margaret, and thank you, Professor Chen. And you've been watching Dialogue here on CGTN. I'm Joe in Beijing. Thank you so much for watching. Goodbye.